Knock, knock. Hi, how are we doing today?
Good.
So my name is Maura. I'm going to be your nurse today. I'm just going to start off by washing my hands. So today I thought we could do a full head-to-toe assessment, if that's okay with you. Great. Just going to put some gloves on. Okay, so first of all, we get started off, can you, let me see your wristband. Can you tell me your name and your birthday?
Jason Quint, 6/8/82.
Perfect. Do you know where you are today?
Yeah, I'm at the doctor's office.
All right, and do you know what year it is?
2020.
Awesome. So like I said, we're going to do a full head-to-toe assessment. Excuse me. I'm going to start by asking some questions about your cardiac and respiratory systems, okay? So are you experiencing any chest pain?
Nope.
Do you experience any numbness or tingling?
Nope.
Have you noticed any sores or rashes on your body?
No.
Have you noticed any swelling in your feet or legs recently?
No.
Okay. Do you experience any shortness of breath recently?
No.
And have you developed a cough of any kind lately?
I have not.
Great. That's awesome. Good news. So now I'm going to palpate. We're going to check your pulse. So I'm going to start by palpating your apical impulse. Palpate is just a fancy word for feel. And then I'm going to auscultate, which is just a fancy word for listen. So to your pulse. So first I'm going to palpate. So at any time, when I'm touching you, if you feel any pain or it's like extra tender or uncomfortable, please let me know, okay? So first I'm going to do is I'm going to palpate it. It's going to be on your left side, 5th intercostal space, mid-clavicular. It's a little below your nipple, so excuse me, it might be awkward. All right, I've palpated the impulse. I'm going to listen. I'm going to have to listen for at least a minute. Just sit tight, relax. It might feel awkward, but it's going to be all right. All right, here we go. Wonderful. Thank you for your patience. So your pulse is 78. You have a strong pulse of the regular rate and rhythm. I'm able to hear your S1 and S2 sounds. There's no other heart sounds present. I also inspected your respirations while I had you relaxed. Your respirations are at 16. Your respirations are quiet. They are unlabored. You have unlabored use of your diaphragm and your external intercostal muscles. I inspected your face, lips, and chest. Their color is even. The tone is even and consistent with the rest of your body. There is inspected for. There's no nasal flaring or pursed lip breathing. And I just would like to see your fingers. All right. Can I see the other side? Thank you. If you could just hold them up like this. All right. So your nail buds are pink. Where the nail bed and the skin come together is about a 160-degree angle. Awesome. So now I'm going to listen to your chest, like your lung sounds. I'm going to do posterior in your back and anterior in your front. So if you want to turn to your back, I'll start in the back. So maybe turn a little bit more for me, please. Thank you, thank you. So as I'm auscultating I'm also inspecting your thorax for skin integrity. I'm looking and I don't see any skin breakdown, lesions, rashes. Color is consistent with genetic makeup. I'm also checking for your chest configuration, looking for abnormalities in shape, and everything appears to be normal. I'm going to listen in 8 different areas, so it might take a few minutes. Just keep taking breaths in and breaths out so I can hear everything, okay? Here we go. Okay. Awesome. Normal breath sounds posteriorly. Lobes are clear bilaterally. So we're going to listen to the front. Same thing. I'm going to auscultate in 6 different areas. I'm also, while auscultating, I'm checking, I'm inspecting skin integrity and looking for any chest configuration abnormalities. I see no lesions. Chest color, skin color is consistent with genetic makeup and tone. There's no discoloration, no cyanosis, no pallor. Okay, ready? Last one. Wonderful. Again, normal breath sounds, both lobes clear bilaterally, and yet skin integrity looks great. No abnormalities to chest configuration. So if you want to sit back, I'm going to check your abdominal area. I'm going to ask you a couple questions first. Are you feeling any pain, nausea, or vomiting lately?
Nope.
All right. When is the last time you ate anything?
About 4 hours ago.
Okay. How's your appetite been lately?
Good.
Okay. Do you have any, when is the last time you had a bowel movement?
5 or 6 hours ago.
Okay. Have you been experiencing any constipation or diarrhea lately?
No.
When is the last time you urinated?
About an hour ago.
Okay. Do you have any pain or difficulty urinating?
No.
So now I'm going to inspect your abdomen. So I'm checking skin color and integrity is all good. No scars or lesions. Color is consistent with the rest of the body. The umbilicus is midline, inverted. It's got a nice round, flat shape. So now I'm going to auscultate. So I'm going to listen in all 4 quadrants until I hear bowel sounds. I'm going to go in a clockwise rotation. Okay. Bowel sounds are all present. They're hyperactive in the lower left region. Now I'm going to palpate for just to see if, again, any tenderness, swelling. There appears to be no tenderness or swelling or pain anywhere in the abdomen or no distension visible. Okay, Mr. Quinn, now we're going to assess your upper limbs and your lower limbs. So I'll assess them and then we'll check your range of motion and your muscle strength. Does that sound okay?
Sure.
Great. Can you put your arm straight out for me? Thank you. So I hope you can see me. Okay, so I'm checking skin and arms are warm to touch. They are symmetrical. There is no edema. There's no rashes, wounds, or lesions. They look good. Check your hands. So I'm going to see both. Alright, skin turgor and cap reflow are less than 2 seconds. There's no clubbing visible in the fingers. The joints appear to not be swollen. There's no nodules. So if you can put your arms out, we're going to do a little range of motion. Can you supinate? Alright, can you show me, can you rotate? We call it circumvent your wrists. How about your arms? Thank you. Can you flex or extend? Any discomfort? Any swollen?
No.
Right, there appears to be no joints. The joints appear not to be swollen or discomfort. Alright, so now I'm going to do a couple strength tests. Can you grab my fingers, grip them as hard as you can? Alright. Now I'm going to assess arm strength first of all. I can feel no crepitus, no problems here. So what I'm going to ask you to do is push against my hand. Okay, and then, okay. Same on this side, we're going to push and then pull. So we're going to range of motion here, no crepitus, no problems. Push, okay, and then pull. Alright. Okay, so if you can lay down, I'll check your lower legs, or lower extremities, excuse me. So I'm assessing the legs. They are symmetrical. The color is consistent with the rest of his body. There's no cyanosis, no pallor, no redness. There is no edema present. The hair is evenly distributed. They are warm to the touch. Feet also warm to the touch. No swelling, no edema present. You can lift your foot up, sir. No ulcers or wounds on the bottom. Ulcers and wounds on the bottom. I'm going to check your pedal pulses if you don't mind. So, pedal pulses are present. They're strong. They're equal bilaterally. And calf refill in the toes is less than 2%. Not 2%, excuse me, less than 2 seconds. Now we're going to check your range of motion. So can you flex and extend your legs for me? Thank you. On this one. Can you circumvent? You just sort of got to move in a circle. There we go. On this side. That's awkward with the couch. Thank you. So now we're going to check for strength. Can you lift your foot up? Can you push against my hand? Okay. How about try to pull my hand? Okay. How about this one? All right. And this one. Okay. We're going to do the same thing with the legs. Again, we're going to push and pull. So I'm pushing down. You're going to push up. All right. And this one. Okay. I'll put your leg underneath me. Can you pull down? Thank you. All right, we're all set. Upper and lower extremities look great. You want to help me sit up? Or I'll help you sit up, excuse me. Okay, we're just about finished. We're going to do a couple neurological checks. So as far as speech is concerned, you are able to both communicate, you can express and recept communication. You are oriented, as far as orientation is, assessing that you are fully orientated, you're fully awake, you're orientated to person, place, and time. We did with those questions I asked you in the beginning. You're able to respond to verbal commands and some stimuli. And you have no visible facial drooping at all. I'd like to assess your involuntary motion. So if we could just stand up. I'm going to ask you just to close your eyes for a few seconds. And I'm going to monitor you for about 20 seconds to see if you have any swaying or involuntary muscle movements. Okay, you don't appear to have any swaying or involuntary muscle movements. Next, we're going to do a little exercise. I'm going to keep your eyes closed, and I'm going to poke you lightly poke you with an object that's going to be either sharp, like this, or dull, like that. Okay, and we're just going to test if you can feel, touch, your pain receptors are working. Okay? So your eyes closed. All right, here we go.
Dull.
All right.
Sharp. Dull. Sharp.
Okay.
Dull. Sharp. Dull. Sharp.
Great. There seems to be no issue with you want to have a seat. Assessing your pain sensations with touch. We're going to finish off with just a real quick eye assessment. I'm just going to check for reactivity, accommodation, and convergence. So if you want to sit back, I'm going to dim the light, turn the lights off real quick. I'm going to test your eyes. I'm going to shine this light in your eye. If you could take your glasses off for me, I'd appreciate that. So I'm going to shine the light in your eye. We're just going to see reactivity, okay? One more time. Oh, you okay? Okay, now I'm going to do the other side. Great. Your eyes are equal, reactive to light. Symmetrical. All right, now I'm going to check for accommodation. So this is to see if you can constrict and dilate appropriately. I'm going to ask you to look at the pen. Look at the TV and then look at the pen, okay? Ready? Pen, TV, pen. Great. Accommodation is perfect. You constrict for close, dilate for distance. Last, I'm going to check your convergence. So it's sort of like a cross-eye test. I'm just going to have you follow this directly to your nose. Are you ready? They converge. Wonderful. That concludes all of my tests today. I'm going to wash my hands and remove my gloves and wash my hands before I leave. Is there anything else I can get for you, Mr. Quint?
No.
Okay. If you have anything or you have any questions, please don't hesitate. Here is your call light. Thank you so much, and you have a wonderful day.
Thank you.